My name is Riitta Dlodlo. I'm a medical doctor with public health degree and experience. I'm a senior advisor with the union, and I work mostly together with the departments of TB and training and education. I will talk about the TBData4Action approach or method, and it's something that makes and assists us to regularly tabulate and analyze routinely collected and available TB data together in conjunction with local staff, be they working at health facility level, district level, or other subnational levels, so as to improve access as well as quality of TB care and prevention services. Everybody will benefit from TBData4Action in a way or another. The primary beneficiaries are obviously people with TB, their families and communities, but also we, the health professionals and the national TB programs that are to provide services for people with TB will benefit. TBData4Action is unique in that it utilizes something that all of us have, but we very often do not use regularly, or we do not use it fully. We will look at, as I mentioned, routinely collected and reported data at each level of health services, including the primary level of care. And we do it together with the people, with the local staff and TB coordinators. In that way, we will be able to see what the gaps and challenges are at each level of health services and take action accordingly. We will be able to detect so-called cold spots where TB coordinators and TB focal nurses may need to pay more attention than in other parts of the services. In today's situation, where national TB programs have less access to external funding, we need to look for ways how we can do more with less. We need efficiencies. We need to identify efficiencies and savings. And TBData4Action is one of those ways which will assist national programs to do exactly that. TBData4Action looks into TB presumption, TB treatment, as well as TB treatment outcomes. And it's an approach which, utilizing care cascade approach, care cascade analysis approach, will assist TB programs and TB staff to detect the challenges at any stage of the TB care continuum. It has been created by a team of people, naturally, including other union consultants, the national TB program in Zimbabwe in particular. I want to make a difference in my work, and I believe that TBData4Action is something that makes a difference, not only in my work, but also in the work of national TB programs, and that's the reason that keeps me going. I love seeing how the learners or persons who are first exposed to the ideas and the concept or the approach of TBData4Action, how their eyes open when they see that they actually have all the resources, the data that we have already spoken about, available and just awaiting to be used for the benefit of the services as well as the patients. It gives ownership to the teams and to the persons who look after persons with TB, whether presumed TB or diagnosed TB, as well as the persons who work, for example, at the central level at national TB programs. Having the feeling of ownership makes people, all of us, motivated to do our work even better. We will also see results, because TBData4Action is something which enables and facilitates regular, perhaps quarterly or even monthly review of the data. This helps the TB coordinators, for example, to know what is the progress, what action or what is the impact of the action that has been realized since the previous review of the data. We must work smarter, not harder. And I would like to quote my colleague, Professor Jane Carter, one of the union's past presidents, who has said that TBData4Action is the next DOTS strategy. In other words, an innovation that the union can share with the rest of the world as a contribution to ending TB. I would say that there is no national TB program in high TB burden settings that could afford not to consider TBData4Action and adapt it to their circumstances and to their settings and integrate TBData4Action to their routine ongoing activities such as support supervision and performance review meetings.